In today's video, we're going to explore how to utilize the candidate performance report that is sent out by the NCSPN after candidates have not passed their NCLEX exam. And the CPR can serve as a guidance, as a guideline for your personalized study plan. And in today's video, we're going to take a look at how to best accomplish that. And what better way than to look at it through a nursing lens? So we're going to follow the nursing process here. So first, we need to assess the strengths and weaknesses of the candidate. And the CPR lays a great foundation for that by categorizing each domain for you and letting you know if you've been above, near, or below the passing standard. So this will help you analyzing where the areas that you were strong and the areas where you need to review and pay more attention and dedicate more time to. After you've assessed your strengths and weaknesses, you can come up with a prioritized study plan. And just like in patient care, you should have manageable goals and it should be time-based so that then you have kind of a deadline of when you can accomplish certain milestones in this review process. After you've come up with your plan, that should also focus mostly on the areas that you were unsuccessful, that you were below the passing standard, but you should also dedicate a small portion of the time to the areas where you actually were above or near the passing standard so that those are still fresh in your memory as well. So after you've prioritized your study plan, you should plan your study schedule. And it is most important that you pick a single trusted source that'll help you in your study review sessions, because they will give you a deeper understanding and also allow you to focus on a targeted practice, because most, or actually all, of the NCLEX review sources that are out there nowadays, they give you reports that are very similar to the candidate performance report, where they actually give you the analytics of how you did in these practice sessions. And once you find that single trusted source that will best suit your learning needs, you should supplement with any other resources, and those can be your textbooks or any other resources that maybe you have access to through your school. In addition, the study schedule and the study plan itself should actually focus on your personal study preferences and learning style. So whether you're a visual, an auditory, or a kinesthetic learner, should incorporate in the plan, should be incorporated into the plan so that it fits your personal style. Now, after you've planned your study schedule, you're going to implement your plan, and there is nothing better than practice questions after practice questions. And make sure that whatever source you use, that these practice questions will give you the rationales for the correct as well as the incorrect answers, so that way you can learn from each practice question if you've selected the incorrect one, or even if it was the correct one, knowing why this one is correct and the other ones are not. And you should also focus on simulating exam day the closer it comes to that rescheduled exam date, because you want to review the rules for the testing site, maybe come up with some relaxation techniques you can do the day before. You want to review the NCSPN's guidelines on how the exam is conducted and all those guidelines, so that you really feel ready to go ahead and take the test. Now, after you implement your plan, you want to evaluate your study progress. And self-assessments are a great tool, and again, most of the online resources that are available will give you these targeted and timed quizzes and self-assessments, where you now can kind of simulate the NCLEX exam and get the personalized feedback there, and then evaluate your progress to see how you did, how you improved on these areas that you needed improvement on. Now, based on the self-assessment results, you're either going to go ahead and say, yes, I am ready, or maybe then you need to go back to the assessment phase and figuring out again what it is that maybe didn't go so well on your evaluation, and then go through the process again until you arrive here evaluating your progress and you feel ready to go for passing your NCLEX exam. And of course, a trusted resource that will serve you well is UWorld Nursing and all their QBank tools that we're going to review in the next video of the series, so that you can see how it will benefit you as you're tackling the NCLEX preparation so you can pass this very important exam. Thanks for watching.